We are Group Synapse. We make smart connections. Here we present a roadmap for our client Cybertron Pharma to grow into a $250 million company in 5 years. Cybertron Pharma requires a business strategy for expansion in the Asia-Pacific market to increase their revenues from $50 million to $250 million in 5 years' time. If left without an intervention, Cybertron Pharma, that's growing at 12% CAGR, will reach a revenue of $88.1 million by 2023. Therefore, it requires an expansion to account for an additional $162 million in revenue. So we have identified two geographies, Australia and Taiwan, for Cybertron Pharma to do a deep dive in. In Australia, it should focus on expanding its oncology business by acquiring distributorship deal in anti-PD-1, PD-L1 drugs. And it should aim to tap 5 to 10% of the anti-PD-1, PD-L1 therapy market in Australia to earn a revenue between 100 to $200 million in the fifth year of business. In Taiwan, Cybertron should enter the market with its existing generic insulin glargine. Cybertron needs to raise awareness amongst medical practitioners in Taiwan to include more insulin glargine in their prescriptions. And it should aim to tap about 20 to 30% of this untapped insulin market in Taiwan in the fifth year of their business to earn a revenue of $62 to $65 million. So why Australia? Cybertron already has a very strong presence in Australia within the oncology market, and its presence can be leveraged upon logistically for further expansion. We assume that Cybertron has existing sales and marketing team, subsidiary offices, and all the logistic and business relations and connections required to bring in a new product and expand business quickly and at a small cost. Why oncology in Australia? Australia has a very high burden of cancer occurrence. It is in fact one of the highest in the world, and the top cancer types occurring in Australia are prostate, bowel, breast, melanoma, and lung. And out of these, about 50% of the cancer types can actually be treated by the modern immuno-oncotherapy, which is anti-PD-1, PD-L1 inhibitors. PD-1, PD-L1 inhibitors are creating a lot of buzz, including the 2018 Nobel Prize given to James P. Allison and his counterpart in Japan. Anti-PD-1, PD-L1 therapy is also driving the largest spending in the oncology therapy market, both in US and outside. We do not show the US data here, but this graph actually shows in the rest of the world oncology therapy market spending has gone up from $35 billion to $60.6 billion, and a large part of this increase is due to the PD-1, PD-L1 therapy. In fact, it's $15 billion that this one sector is responsible for. The Australian market is actually very, very lucrative because it lacks a few of the new oncology drugs. Out of the 55 globally available new oncology drugs launched between 2012 and 2016, 27 of these drugs are not available in Australia. So this is an opportunity. It's a gap in the market. Having said that it's not available doesn't mean that Australia is not open to taking up new drugs or new therapies. It is open to adopting new therapies. PD-1, PD-L1 inhibitors are in fact taken up by Australians only just after Americans, Germans, and French. It is fourth in the developed world for the uptake of number of units of PD-1 and PD-L1 inhibitors. So there is a huge opportunity here for Cybertron Pharma. Australian market is a developed market. It can afford new patented drugs. So if you look at this graph, which shows monthly drug prices in comparison to the per capita GDP of these countries, and this is data for 8 patented drugs. In fact, Australia shows excellent affordability of patented drugs. In fact, ahead of USA and South Africa or China. And in fact, if you look overall in the developed market, spending is driven in the oncology market by the new drugs. So the blue here shows drugs that are launched in the last 0 to 5 years. And in fact, developed markets spend more in these new drugs compared to the older ones. Australian government as of 2017 has made key policy changes to actually facilitate modern cancer therapy for Australians. This includes introduction of new registration paths and improved reimbursement paths for patients undergoing cancer therapy. Currently, in the PD-1, PD-L1 market, the key players are Bristol Myers Squibb, Ono, and Merck. Can Cybertron Pharma have a part of this pie? Even if it's a small piece, can we have a piece of this pie? The strategy that Cybertron Pharma should go ahead in Australia is it should enter a licensing or distribution deal with BMS, Ono, or Merck and aim for 5 to 10% of the PD-1, PD-L1 inhibitor sales market by 2022. We have few key statistics in Australia. Every year, there are about 138,000 new cancer cases. And estimated deaths every year is 49,000. So therefore, the number of patients that were living with cancer in Australia in 2012 were 420,000. And we also know that the median cost of PD-1, PD-L1 therapy per patient per year is 150,000. We make a few calculations and assumptions based on these statistics. So the number of patients surviving per year is the number of patients being diagnosed minus the number of patients dying. So there's about 80,000 patients that are added to the pool of cancer patients that are alive every year. So based on that calculations, we calculate the number of cancer patients alive in 2018. So it's 80,000 into 6 years plus the number that was alive in 2012. So we assume that there are 900,000 cancer patients in Australia currently. Number of patients in remission is about 15%. This is a data that is based on some literature work, but the remission statistics are not very clear. And we assume that the patient in remission do not relapse in the next 5 years. So by that, we calculate that only 15% of these patients are alive and they require treatment. So 85% of these patients actually are alive and require treatment. So that comes to a number of 765,000 patients in Australia that requires treatment currently. And at the rate at which the number of patients get added, we project the number of patients requiring treatment to grow to 1 billion in year 2022. Then from there, we calculate the number of patients that are actually melanoma, lung, and bowel cancer. So based on previous data that I've presented, it's about 50% of the total cancer occurrences in Australia. So from there, we derive these numbers. And the number of patients with metastatic melanoma and non-small cell lung cancer, gastric, and CRC, which are actually eligible for the anti-PD-1, PD-L1 inhibitors, are about 25% of the above numbers. So that is how we derive these numbers. And based on affordability, and there is secondary data which we haven't shown here, we assume that about 10% of these numbers can actually afford the expensive PD-1, PD-L1 therapy. So if going by that and going by the fact that one patient per year requires $150,000 for this kind of therapy, we assume that the market, or we project that the market will be worth $2 billion in year 2022. And if Cybertron Pharma can tap anywhere between 5 to 10% of this market, we can get revenue worth 100 to 200 million US dollars. The second strategy is to enter into Taiwan with an existing drug, the existing insulin glargine that Cybertron has. So pharmaceutical sales is forecasted to grow in Taiwan, and this is driven mainly by prescription drugs, and within the prescription sector, it's also driven by the generic drug. So the generic drug sales is growing in Taiwan. Taiwan as a market has several strengths. It's one of the more developed markets in Asia Pacific. Therefore, we assume that entry into the Taiwan market is easier. There is strong prescription drug market and generic drug market, and there is a creation of Taiwan FDA that helps in streamlining approvals and registration processes in this country. So it is actually a very lucrative market to enter in as a new business. Why insulin glargine in Taiwan? Taiwan has a very high diabetes burden. About 10.9% of the adult Taiwanese population have diabetes, and that works out to be 2 million people in 2017. And every year there is an increase of 6.86%. That's the statistics between 2000 and 2009. Taiwan has actually, in fact, the lowest usage of insulin, and this is due to prescription patterns or prescription preferences of medical practitioners. Only about 2.4% of type 2 diabetic patients are prescribed insulin in Taiwan, whereas the world median is about 15%. So there is a huge gap, a gap of about 11 to 12%. In between the world median and that of the Taiwan usage of insulin. And this, we think, is an opportunity for Cybertron Pharma, because there's a huge untapped percentage of type 2 diabetics that are not prescribed insulin but should be prescribed insulin. So this is an opportunity. The Taiwan insulin market is relatively uncrowded. It is dominated by the big three: Novo Nordisk, Sanofi, and Lilly. Whereas if you compare to countries like India, China, or Russia, there are 8+ companies registered selling their products, selling or manufacturing their products in that country. So can Cybertron Pharma actually have a significant piece of this pie? That's the question. And if we invest in organizing scientific seminars for endocrinologists and diabetes policymakers, we can raise awareness about the lack of insulin usage in Taiwan. And that's the strategy that Cybertron Pharma should take and enter into the Taiwan market with its existing insulin glargine, the generic form, and capture about 20% of the market by 2023 to get revenue of 60 to 65 million US dollars. The key statistics here are the number of diabetic patients close to 2 million, and they increase at a rate of 6.86 every year, and the cost of treating one patient per year with insulin glargine is 1,000 US dollars. So if we assume that the type 1 diabetes population in Taiwan is less than 1%, then this is considered negligible. So at 15% median insulin consumption, 285,000 people, diabetic people, should be prescribed insulin. But at 2.4%, only 45,000 people are prescribed insulin. So there is an untapped population of 240,000 who should be prescribed insulin but are not currently being prescribed insulin. So based on these numbers, we project the population of untapped eligible population in 2022. And if we get a market size of 20% the year 2022, then Cybertron can make about $62 million US dollars in terms of revenue. So we have come up with two strategies cognizant of cost, because Australia, Cybertron has an existing business. Therefore, to expand in that existing business again might actually be more cost effective than going into a different market. And again, Taiwan is going to meet their ambition of expanding in the Asia Pacific market, but we suggest them to go in with an existing product in their portfolio. Again, that will be cognizant of costs, and we believe that these strategies can easily earn Cybertron revenue anything between 260 million US dollars. An additional revenue of anything between 160 to 265 million US dollars, depending on what market share they are able to tap onto. Thanks a lot, and we would be looking forward to seeing the panelists on the 24th. Thank you very much.